Hi, good afternoon and good morning. Thank you all for attending this very important conversation with the Gathering 57, with the G57, to really drive home our conversations about how are we going to respond and continue our efforts on ending the HIV epidemic initiative in the event of the current pandemic that is gripping almost all parts of the United States and the territories, plainly known as COVID-19 or coronavirus. So I know many people have reached out to myself and our partners and our federal partners especially to make sure that we know what we need to be doing as we drive forward with our conversation. And then also, are there any changes and deliverables and guidelines? And so we're very lucky to have two of our leading partners to help guide us through these conversations. So today, just letting you know, we have Harold Phillips, who is serving as the Chief Operating Officer of the Ending the HIV Epidemic in HHS. Harold, with his decades of experience, has really been focused on ensuring that we have a data-driven response to the epidemic and really guiding the shape of EHE as we're going forward to make sure it's community centered and with true partnership between health departments, health service organizations, and our government partners as well. Today we'll also be joined by Askian Kuzian, who is the Deputy Director of HIV.gov. And in his role, he's providing oversight and management of those day-to-day operations that are very important to making sure that we have our metrics in place. As we're utilizing his expertise around HIV and cybersecurity and digital communications, as we're really trying to make sure that our public health messaging is not only accurate and timely, but that is also culturally responsive, because as we all know through the Denver principles, that there's nothing about us without us. So we have to have that meaningful engagement of people living with HIV and AIDS. So I want to make sure I just give you a quick idea of how the conversation is going to go. We're going to make sure that Harold and Askin will deliver their presentations. And there's going to be a chat box option for you to put questions in the Q&A, which we, of course, will answer immediately thereafter. And then we're going to open up the phone lines. So if there's any other questions that might have arisen, that you can ask them directly. And then, as always, with all G57 calls, we want to make sure that there's space for everyone to share best practices, because I know from listening to many of you that your response to COVID-19 and HIV have sometimes been quite challenging. And so we want to see like what's been going well, and if there's anything that we need to learn as we're going forward and having this collaborative response. So thank you again for joining today. And now I will turn it over to Harold and Askian for their presentation. Gentlemen.
Great. Thank you, Ace. Good afternoon and to everyone. It is wonderful to be here with you, to have this chance to update you on some of the activities that the Office of Infectious Disease Policy has been involved in with regard to EHE. Before I go on, I want to first thank you all, especially those who have been involved in the front line as part of the response for COVID-19, and your continued efforts to serve those communities that are impacted by not only HIV, but now this new infectious disease that has emerged. We know that it has been quite challenging, but many of you have been in our thoughts and prayers as you continue to do this extremely valuable work. Today, we're going to talk, as Ace said, a little bit about where we are with our update on activities regarding ending the HIV epidemic. And we're going to spend a great deal of time talking about the dashboard known as EHE. And Askian will give some more details on that. Next slide, Askian. So again, both of us will be presenting from our office, and our objective today, talking about ahead, is also to spend some time with you all around the dashboard. For many of you all, this may be your first introduction to the dashboard, and we will talk about its creation, the process, as well as talk about your role with the dashboard and how we hope you will interact with the dashboard as well. We'll also spend some time talking about our timelines for dashboard development and release, and then I think get some initial thoughts and feedback on the dashboard itself. Next slide. So again, announced as part of the State of the Union address, the EHE initiative, and our geographic focus, especially with the phase 1 jurisdictions, those counties, including both San Juan, DC, that are those areas, and our 7 states where we have the greatest burden of HIV disease in this country. You all, as part of the 57 jurisdictions, or as NMAC likes to call you, the G57. Next slide. So the initiative overall still remains an administration priority. One of the things that Admiral Giroir said to us, about 9 weeks ago, was the fact that EHE remains a priority, HIV remains a priority, and then it was up to us to continue to work with the federal agencies as well as our stakeholders on the ground to continue to ensure that there was access to services, but that include prevention services as well. So we have been working over the last 9 weeks with our federal colleagues to find that sweet spot of how to continue to move the EHE forward as a priority, as well as doing some strategic thinking and also some resetting of some of our approaches to be sensitive to what's happening and the new realities given COVID-19. And we've done a lot of this in combination with our federal partners as well, who I also have to commend for their work in both moving forward with COVID-19 funding, as well as adjusting policies and procedures that might have gotten in the way of implementing different service models such as telehealth. Next slide. So some of our major accomplishments with EHE moving forward, and this includes the accomplishments of both our first quarter and as we wrapped up our second quarter at the end of March. The work that was done with establishing the PACE teams in Region 4, 6, and 9. Those individuals are commissioned corps officers that are located in Atlanta, Dallas, and Los Angeles. They continue to work across those states that are located within those regions, and even now are providing some expertise, also helping to link health centers and other providers to some of the resources, and continuing to sort of serve as our eyes and ears closer to the ground, helping to inform our work within OIDP. The Jumpstart programs that happened within the jurisdictions of East Baton Rouge, Baltimore, and DeKalb County outside of Atlanta. The work there continues as they implement additional models for both diagnosis, linkage, and engagement in care. That has been underway. All of the jurisdictions were able to develop their draft plans for community engagement, and all of the jurisdictions received feedback at the end of March, and that feedback is a combination of input from CDC, HRSA, and our office in OASH. Also, the funds were awarded for PrEP initiation in the health centers through HRSA, and also the funding through the Ryan White program to that is EHE related was also awarded in early March. So those activities moved forward prior to us socially distancing. Also, the work of the HHS PrEP program, Ready, Set, PrEP, continues as well. Not only has that work continued, but we are also thinking about and conceptualizing the next phase of the communication collateral for that program as well. Next slide. In addition, and just quickly, and you'll hear about the dashboard and the dashboard development, so I won't go into a lot more detail on that. We have also been working closely with our partners at HUD in the HOPWA program, helping to engage them in our EHE work and looking at different ways that we can collaborate together, as well as focusing on some jurisdictional, targeted jurisdictional issues that may be impacting our EHE goals and ways that we can work across our programs. We are also looking at the ability to form additional partnerships with CMS and other parts of the federal government, and using the National HIV Strategic Plan in that way as well to help us. And we continue our developing our engagement strategy, because we realize that for EHE to be successful, it's a whole of society initiative. And so we need academic institutions, fraternities, sororities, faith-based institutions to also help us, because they play a key role in this work as well. So a lot has been happening with EHE. I know at the end of Oskian's presentation, we will have the opportunity for you all to ask us questions using the chat box. So I look forward to some additional conversations with you all. But again, this remains a priority. One of the things we have been asked is whether or not we are looking to adjust our goals and the targets. Currently, we're not, because to do that, we would be admitting that we're okay with another 38,000 infections this year in the United States. So while we recognize that some activities will be delayed, we're still doing everything we can to move the initiative forward and to ensure that there is access to both comprehensive prevention, but also comprehensive care, treatment that leads to viral suppression that will also help us in our goals. So with that, I think my slides are done. Next slide. And I'll turn it over to Oskian. Thank you.
Hey, thank you, Harold. Good afternoon, everyone. My name is Oskian Kazuyan, and I'm with OIDP. And before I get into an overview of the dashboard, I just wanted to thank NMAC for extending the invitation to Harold and myself to be here with you today. I think we're very excited about that. And also to echo Harold's appreciation and gratitude for all of those of you on the front line who are helping out through this, through the COVID-19 epidemic. And so with that, let me just pick up where Harold has left off and talk a little bit about the dashboard. What you'll hear me talk about today is an overview, a little bit about the timeline, the approach that we're taking, and also a little bit about stakeholder engagement opportunities, and also look forward to any questions that you might have at the end of our presentation today. So as part of our EHE implementation efforts, we've been working over the last several months to develop a data analysis and visualization system, which we're calling the dashboard ahead. And the dashboard will visualize data, and I'll talk a little bit about that data in a few moments, that will hopefully support the jurisdictions in reaching the goals of ending the HIV epidemic by 2030. The dashboard is going to display baseline data, but indicator data targets for 6 HIV indicators. And using these baseline data, the indicators, hopefully users will be able to monitor their progress, our collective progress, I should say, towards reaching the goal of reducing incidence by 2030. Here, let me just give you a brief overview of the indicators that we'll be using to monitor progress towards implementing EHE. They will be incidence, knowledge of status, diagnoses, linkage to HIV care, viral suppression, and PrEP coverage. Our overarching goal, of course, is incidence, and we'll be using the leading indicators to just monitor our progress towards achieving that goal. 75% reduction by 2025 and a 90% reduction by 2030. Before I talk about our audiences and who we anticipate that will use the dashboard, let me just say that at the outset, when we launch the dashboard, we will be using 2017 as the baseline year for our targets, and the dashboard will display the 2017 data for all 57 jurisdictions, as well as the 2018 data, which was released and is now available. So the dashboard upon release will have those 2 years worth of data in it. So just as an FYI and for your planning purposes. Of course, the primary audience that we feel will be engaging and benefit from the dashboard will be the 57 phase 1 EHE jurisdictions, but we anticipate that others will find it useful, and hopefully as we continue to build out the dashboard, more and more users will find it as a useful resource for them, something that they can turn to. We anticipate that some of these other users might be local and state government stakeholders, advocacy groups, universities, research organizations, and other think tanks, and a wide array of potential audiences and users for the dashboard. This slide is particularly about the approach that we're going to be taking. It is a phased approach. We feel that will be most helpful in terms of our being able to roll out iterations of the dashboard, and at the same time taking opportunities throughout the development process to get your vital input and feedback, not only on what we're planning to build, but also on what your experience using what we've previously built has been. So we want to be able to hear from you, and I'll talk a little bit about what those opportunities are in a slide or two. So the initial dashboard, in terms of a timeline, we're hoping that we'll be able to release the first version of it in June of this year. It'll be public facing, and it will include the baseline data for the indicators and the 2018 data that I mentioned. We'll also have some resources on there, but initially it will really be a display, a visualized display through graphs, charts, tables of the 2017 baseline and the 2018 data for those indicators for all 57 EHE jurisdictions. You hear me using the word version a couple of times, and that's because the approach that we're taking is going to be one in which we go through an iterative process. On some frequency, we will continue to build out the dashboard until we develop a fully robust interactive version, which will not just be a display of the data, but also will have some advanced features and functionalities that will allow manipulation and analysis of the indicator data. And that will be going on as soon as we launch. We're already beginning to embark and start doing some planning on that interactive version of the dashboard. Here there are some displays. This is what the dashboard looks like, but I thought it might be helpful to take it out of the sort of conceptual abstract and be able to put some visuals to it. So here's a couple of pages of the dashboard, and here are a couple more. So we'll have mapping functionality as one way to navigate the dashboard and get to those jurisdictions. And so that's a little bit of that. So stakeholder engagement is going to be very, very important to us. We feel it's going to be absolutely critical to be able to get the feedback of the jurisdictions, because they'll be the primary users of this tool. So we plan to conduct surveys, we'll have listening sessions, we'll have webinars. We're considering a series of webinars as a way to engage with our stakeholders and be able to get their feedback. We'll also be participating in conferences, even virtually. Even now, we're thinking about how we can robustly participate virtually in conferences so that we don't lose out on the opportunities that we would have traditionally just been present at. We don't want to miss those opportunities to engage with potential users. So we're also going to be creating a what is in short form a social media toolkit that will have social media posts, graphics for a range of audiences. We're tailoring them to the jurisdictions themselves, so there are things that you can customize. Also developing some for local and state government to be able to use as well. We'll have graphics that could be shared. We're putting together email blurbs and also a one-pager. And that what you're seeing there is some of the draft material looks like. And again, that's me and that's Harold. So at this point, that's sort of the conclusion of our presentation. There'll be an opportunity for us to answer any questions that you might have, and I'll turn it over to Ace and NMAC to walk us through the rest of the hour.
Thank you. Thank you. Very informative. I'm super glad to see the amount of work that you guys are doing to make sure that stakeholders are central to our response. And that social media piece is so important when we're trying to be culturally responsive to so many different communities that are impacted by HIV. So thank you both for the presentation. First, I guess before we open up the lines, I want to ask Chip if we have any questions in the chat box for Harold and Oscar.
We do, and can you hear me okay?
Yes.
Yep.
All right, so we have several questions. Will the submission deadline for submitting the final EHE plan be extended beyond September 30th?
So at this point, I have not heard from CDC that they are looking to extend that deadline beyond September 30th. One of the issues from the federal level is the need to make the awards by the end of September to award those funds within this federal fiscal year. So it may be extremely difficult to extend it beyond the current deadline in order to make that happen.
All right, can you still hear me? Okay. Will CDC be releasing revised guidance for writing the final EHE plans?
That has not been discussed yet at my level. I would definitely encourage you to check with your federal project officer to see if internally those discussions about sort of revising that guidance. I do know that all of the jurisdictions received feedback on their community planning process, and that currently there have been no revisions to the actual guidance for the development of the implementation plans.
Thank you.
Okay. Next question. Will this happen in partnership with AETC?
So, Chip, I'm not sure what the "it" exactly is. The AETCs, which were awarded $3 million in EHE funding, received, they are currently in the process of submitting their work plans to HRSA. Actually, those might have been due at the end of April for HRSA review of those plans. But they are working to address some of the workforce needs in relation to EHE. So hopefully that helps and answers that question.
Okay. And next question. Sorry, 1 second here. What platform is being used to develop EHE?
Thank you. The initial version of it is in strict HTML, and we're investigating as part of the sort of development of the interactive version, which will be much more robust. And so we'll have a much deeper and broader set of functional requirements as to what the best platform will be. We haven't decided anything yet. We're just researching based on what our functional requirements will be, what platform would best suit those requirements.
Okay, and one other question here. There was news that EHE plans are now due December 31st, 2020. Where did that info come from? I have shared that info with phase 1 jurisdictions in my state, so if that is incorrect, please let us know.
So that information came from CDC about the due date for the revised implementation plan. And that revised due date is designed to give jurisdictions the opportunity to respond to the additional guidance and feedback that we've received from the federal agencies regarding the community plans, and to also think about, especially during these challenging times, how you might approach community engagement in light of what's happening now, and that you may also need to develop new ways and methods for community engagement in order to meet that deadline. So CDC wanted to give maximum time and flexibility for those who received extensive feedback on their plans.
All right, next question. Will the data presented be national only or also for the jurisdictions? Will HHS be consulting with the jurisdictions on the data?
I'll take that, Chip, and Harold can weigh in as appropriate. Thank you. Very thoughtful question, and I'll be updating my PowerPoint slides to make sure that that gets covered in there, because I should have known to put it in. But yes, thank you. So it'll be national data, and it'll be jurisdictional data for all 6 indicators. So the way that it's grouped right now is that there'll be a page nationally for all 6 indicators, and then there'll be individual indicator pages for each of those 6 that goes national, state, down to county, and then individual county pages that will go through each of the indicators for that particular county. So we're looking at it 3-way. Hopefully one of those will be most helpful, but it is being presented in a variety of ways for national, state, and local data.
Thank you for that.
There was a second. Thank you, Harold. I don't know if you want to pick up on that second part of that question.
I was going to add to that piece, and the data that will be displayed, because it is a federal website, and also as HHS, it is data that has been cleared and vetted through CDC. So we will be using the data that comes from them and not necessarily the data that might originate without going through the CDC process on the website.
And let me just pick up, because that question had a second part, and I don't want it to just seem as if we've ignored it. I think the question was, will we be consulting with the jurisdictions about the data? So just as an FYI, we're planning to have a webinar with the jurisdictions before any launch of the dashboard, just to be able to do a much deeper walkthrough of the data and to review what data is there for each of those jurisdictions. So that's in the planning process, and hopefully we'll have some more details to share about that, but just want you to know that that question has been taken into consideration. We didn't ignore it.
And I think it's also important to reiterate that prior to the dashboard, that it is our plan to have a call with the jurisdictions to walk through the data that Oskian described, both the national, the state, and the local data, so that you all are aware of what data will be posted and publicly available, so that you all also, as jurisdictional leads, have the opportunity to understand it and perhaps ask any questions you might have of us, as well as CDC, who will participate in the technical aspects of the data walkthrough.
All right, and we have no additional questions in the chat box right now. So.
Thank you. And as we open the lines up to everyone, please make sure that as your line is opened, if you have a lot of background noise, to please remute yourself. Thank you both for giving a deeper dive into the information and the important updates on timelines. And I know at NMAC, we are restarting our community engagement as well in the land of COVID with supporting jurisdictions with their virtual meetings and making sure that community feedback is there. Can you speak a little bit? I think, Oskian, you were sharing that virtual meetings are about to begin or are in the process of being developed. responsible for EHE. Can you speak a little bit more about the virtual meetings that you guys are also putting together?
Thank you, Ace. Good question. I'm going to actually, Harold is sort of has that big picture about the meetings that we as the office are sort of putting together, and I'll let him do on that. But just as a reminder that we'll be doing a series for engagement about the dashboard, but I'll just let Harold talk about it in a larger sense.
So for us, thanks for that question, Ace. For us, there are a couple of engagement meetings that we have been thinking about and planning to do virtually. I think they were always planned to be virtual meetings. One we just mentioned is around the dashboard, first with the jurisdictional leads to walk them through and help them familiarize themselves with the dashboard, as well as what data will be displayed on the dashboard, like I said, at the national, state, and county level. The other webinar that we are thinking about, and this may be in July, is an overall EHE update. And providing some insight and some guidance as to where we are with various aspects of EHE. And I think also, like we've tried to do on this call, reiterating that it is still important administration priority. So those are at least the two that we are planning. We had previously talked in the office about trying to do quarterly EHE updates, stakeholder updates for the community and key stakeholders, just so that they're aware of our progress. So we will probably go into that mode as well, especially because some of the in-person opportunities that might have existed through USCA, the Ryan White Conference, NASDAQ annual meeting now have been shifted or are shifting. So the ability to update virtually, we're going to try and take more advantage of that.
Thank you. And one question that came from the jurisdiction, this is for the entire group, for all the people who are on, and then also for you guys as federal partners. It was related to HIV testing, self-testing kits. There's been through the CMS waivers, the allotment of funding, or be able to utilize the funding for HIV self-testing in your home. So wanted to get some ideas on how some people have heard, how people have implemented that within their jurisdictions. And of course, asking if Harold, if you guys want to give feedback, but the question was for the entire group as to how they're utilizing funding to ensure HIV testing is happening within their jurisdiction.
So I think while others sort of get ready to prepare around that, one of the things that I wanted to highlight, in case it did get missed, is that CDC sent out guidance to its recipients talking about the allowable use of funds for HIV self-testing, especially during this time of social distancing, and the need to ensure that individuals in the community have access to HIV diagnosis tools. So self-testing as a great way to be able to do that. In addition, SAMHSA has also let its recipients know that the purchase of HIV self-test kits is an allowable expense under their grants as well. We are working with HRSA's Bureau of Primary Health Care, and they may release additional guidance to healthcare recipients in the next couple of weeks as well, along those same lines. Recently on HIV.gov, we did a blog post which highlights the effectiveness of self-test and also talks about at least two models that we are aware of where self-testing has been used. In conversations with OraSure during this period of time during COVID-19, it reduced the price of the HIV self-test, also making it more affordable and reducing that as a burden. So we continue to do some work within that space, and I think that self-testing as a modality hopefully will become more common within the U.S. It has proved very successful in many PEPFAR settings, especially among reaching certain populations, such as men. I've also heard women don't necessarily like to go to clinics either, but as a man, I'm impatient and don't like to sit around and wait. And so self-testing is one proven way, at least in global settings, to reach individuals and make them aware of their diagnosis, which is a key aspect of our EHE efforts.
Thank you. I know we had another query around HOPWA. HOPWA has been added as a central component to the EHE plan. Can you speak to the indicators, the housing indicators that will be included in EHE work? I guess that's for Oskian. If you've added any housing components, like now that HOPWA has become a central component to the EHE response.
So I'll start, and then Oskian, if you wanted to add about sort of the thoughts about how we would add additional resources to the dashboard. So currently within EHE, we are not including any EHE indicators. EHE being sort of the operational plan for how we're going to move toward ending the HIV epidemic within the United States. It's the operational plan for our HHS-related activities. There are, however, and we'll probably talk about this coming up very soon in the future, the National HIV Strategy does have indicators that relate to HIV housing and homelessness. So we will be tracking and reporting our progress with regard to the National Strategy indicators, four have been adopted, four of which include the EHE, four of the EHE related indicators, but also we've added HIV homelessness and stigma reduction and elimination as part of the National HIV Strategy goals. And we'll be reporting on those using the strategy reporting methodology and methods, but also will be including that in some fashion on the dashboard as well. And I'll turn it over to Oskian to talk about the dashboard and other resources or data that we may include on the dashboard outside of the indicators.
Okay. Yep. Thank you, Harold, and thank you to the person who asked that question. Again, another thoughtful question, and it's sort of exciting to be here and hear some of the questions and the caliber of them. So thank you so much. As part of the sort of future iterations, and you heard me talk about this sort of iterative process that we're going to be taking, that we'll be releasing updates to the dashboard in the coming months on a fairly regular basis until we complete what is an interactive version of the dashboard. Just to manage expectations a little bit, when we say interactive version of the dashboard, it is not a sort of succinct, discrete deliverable, like in a year we'll have another dashboard. It is that we'll be getting to what will be in sort of qualitatively an interactive version through these iterations. So you'll see a lot more robust features being added in over time, not just ones at one time towards like a year-end goal or something like that. As part of that process, we're going to be adding additional data as they become available. So we'll be adding additional data for annual data for the indicators that are part of the EHE monitoring process, the 6 that you heard me sort of talk about. So when 2019 data becomes available, we'll add that and so on over time. But we'll also be adding new and different data, such as things that like the HOPWA data to the dashboard as either part of the data sections or as part of the additional resources sections. There'll be additional resources that are part of the dashboard, recognizing that the heart of the dashboard is really the data for those 6 indicators, but there'll be additional resources. And some of that additional data may end up on the dashboard in terms of additional resources, or it may be part of the data sections. And if you have questions about other sources of data, because there are a number of social determinants of health that could be included, we'll be working through a work group that consists of all our federal partners and hopefully broader through this engagement process, what those other data should be that should be included in the dashboard. So nothing's been finalized or determined yet, but we're open to what those might be.
Thank you. Another question related to the future of EHE. Will the 57 jurisdictions that were identified for the first round all still be funded in the future? And how will you identify additional jurisdictions for subsequent years? So the summary of that question is, will the 57 jurisdictions that were funded in for this cycle be funded again? Is that guaranteed that they'll be funded again? And then in the future, if we're going to have more than 57 jurisdictions, how will you come up with those 57 jurisdictions?
So thank you for that question. The EHE, the Ending the HIV Epidemic Initiative, has the phase 1 jurisdiction. So the 57 that received funding for fiscal year 2020 are those 57 jurisdictions that represent the high burden areas when it comes to HIV within the country. And so they're responsible for, the counties are responsible for more than 50% of the new transmission and 7 rural states. Those jurisdictions are slated in the President's FY 2021 budget to receive additional funding. Phase 2, the rest of the country, under EHE, are not slated to, we're not slated to begin sort of phase 2 of the initiative until 2025. So we're, at least within our office, beginning to have some thoughts about how do we have some convening and some thoughts around what that phase should look like. So for phase 2, it's slated to begin in 2025. And the other part of the answer to the question, the jurisdictions are currently included in the President's FY 2021 budget for continued funding through the initiative. And the initiative is currently, as it's configured, has a 10-year sort of span to get this done, to reach the reduction in new HIV transmissions by 90% by 2030. So looking forward to continuing to watch the appropriation and budget process, but continuing our efforts. And the rest of the country is paying attention to what's happening within the phase 1 jurisdictions. And they're already looking for lessons learned from this and beginning to think about how they can implement within their jurisdictions too.
Thank you. I don't have any more direct messages. Just Chip, did any more messages arrive in the chat box?
Let's see. A couple of others. Where can we find specific data element for each indicator?
One more time, if you would, Chip, please. Where do you find a specific?
Yeah, the question is, where can we find specific data elements for each indicator?
Okay. So Harold, I'm lost on the sense of the question, but it probably, Harold's nodding his head, so he may have it. Harold, do you know?
So for each of the indicators and their release, we're hoping releasing them in mid-June, to sort of clear all of our hurdles and processes. Now, for some of these data indicators, CDC did release the latest report on incidents. You may be able to find some of it there, but assembled as part of EHE, you will see it when the when the dashboard is released in mid-June.
So just if I could, the data elements, I guess I got tripped up on what elements were. I apologize for that, but through the CDC reporting process is where, as Harold mentioned, all the data that we'll be posting onto the dashboard our CDC data for those indicators. And so our data is coming from CDC. And if you want a further breakdown of some of the data, you can get them in those reporting processes, which were updated last week, as Harold said.
Okay, a couple of questions. Still some confusion over the due date between September 30th and December 30th. Can you clarify which is the actual deadline, the original September 30th date, or are all jurisdictions given an extension to December 30th?
So there are two different things that are due. One is the revised plan for community engagement in EHE. That one has the December deadline. Then the EHE implementation plan, sort of the work and what you will actually do and the services that will be provided along the domains that are within the CDC application. That is due, that is the deadline that has the deadline of this summer. I think is it August 1st or is it? I would have to go back and recheck that deadline because I think it is an August 1st deadline. Ace, do you?
Yes, it was August 1st. That one's the one that was moved to December 31st. It's New Year's, if I'm not mistaken.
Okay, let's get back to everyone on the call on the exact due date so that we're clear on that piece of it. But there are two different things that are due, and so we'll clarify those deadlines.
All right, and no further questions in the chat box right now.
Great. Well, thank you. So I think going forward, when we're looking at how to make sure that we get the very important conversations and the best practices between us, we are having some offline conversations about the easiest way to make that occur so that we don't have as much background noise. So we will probably start moving to some best practices conversations in the future that might be more regional, more focused. So it'll be easier for everyone to speak with each other because I know that is a very invaluable component to these conversations. So in the meantime, I also wanted to thank both of our federal partners for giving a part of their afternoon to speak with us and being open with any questions. We will get back to the entire group on the deadlines from the CDC to make sure that everyone's on the same page. That will be coming soon. And this conversation presentations have been recorded. We'll be able to share those out and also the presentations themselves. So we look forward to speaking with you in the future. We received some feedback that we want to have some conversations with leadership from the CDC and leadership from Papua. So we're going to make sure that happens in the coming weeks and months. Otherwise, feel free to email me. Both Harold and Askin have said they are willing to share their emails, so I will send those out as well. So in the meantime, thank you guys for your attention, and we look forward to speaking with you in the future. And we'll talk to you soon. Have a great afternoon.
Thank you.